Hi, my name is Taiwo Busari. I'm a nursing student, second year, second semester at University of Manitoba. I'm here to make a video of giving insulin through the subcutaneous route and hygiene. So my scenario today is scenario D, Inulin N, NPH insulin through the subcutaneous route. The date is February 7, 2021. The time is 7:45 a.m. Jake Nursing DM type 2. Nursing Jake. The free number is 312-654-987. My patient doesn't have any allergy. Inulin and insulin NPH 12 units through the subcutaneous route. The AM is due for 8 o'clock, but scenario time says 7:45 a.m. I have to transcribe our signature so I can go ahead with the order. I'm just going to be checking my flow sheet to make sure my patient actually needs the med. So Nursing Jake. The free number is 312-654-654-987. Same patient. February 7, 2021 is the same date as my scenario date. 7:40 a.m. is within the time of my scenario time. My scenario time is 7:45 a.m. My patient blood glucose level is 10.8. The normal one is between 5 to 7. I'm checking and no nurse has given it today, so I can go ahead to give the med. I'm just going to be doing my first check and I'm going to bring out my med. Insulin. So Nursing Jake. So Inulin and insulin. This is NPH. This is NPH here. The doctor wants me to give 12 units. I'm going to be giving 12 units. It comes in U100. I can take the 12 units that I need. Through the subcutaneous route, it says for subcutaneous use only. In AM is due for 8 o'clock. It's due for 8 o'clock and my scenario time says 7:45 a.m. so I can go ahead to give the med. I'm just going to be checking my monograph. It's an insulin. An anti-diabetic medication. The doctor wants me to give to the subcutaneous. I can give it to the subcutaneous. It can be given by a nurse or a student nurse. I'm a student nurse, I can give it. For the subcutaneous, the doses are highly variable based on the blood glucose level, which means the doses are individualized. The doctor wants me to give 12 units because my patient's blood glucose is 10.8, so I can go ahead to give the medication. It doesn't have a maximum single dose because the doses are individualized. So it says subcutaneous admitted undiluted. I'm not going to be diluting it, so I'm giving it undiluted. The maximum concentration is 100 units per ml. Says there 100 units per ml. I'm checking my medication and it's not expired yet. It's not distended and it's open because this is a multi-dose valve. I'm checking the mark sheet if my patient have any allergy. My patient doesn't have any allergy. Because it's an NPH, I'm just going to roll this. I'm doing my hand hygiene. I'm taking the appropriate syringe that I need. I'm going to be using the 30 gauge by 3/16. This is within the gauge that can be used for insulin through the subcutaneous route. It's calibrated in U100. This is U100. So it is compatible. The doctor wants me to give 12 units. I'm going to be giving 12 units. I'm going to be drawing out 12 units from here, calibrated in U100. So because it's an NPH, I'm holding this. My patient doesn't have any allergy. This is not distended. It's not expired. I'm doing my hand hygiene again. I'm taking the alcohol swab. I'm going to be cleaning the top of the valve for 30 seconds. I'm going to allow this to dry. I'm going to open. So for the sake of the demo, this is open. On a real life scenario, this is going to be brand new. I'm taking the syringe, I'm opening my brand new syringe, I'm bringing this out, putting this in the garbage. The doctor wants 12 units. This is calibrated in U100. Doctor wants this calibrated in U100. So I'm going to be giving 12 units. This is 10 and this is 12. So I'm just going to be dragging all the way to 12. So right now I'm currently in 12. I'm just gonna show the camera that I am in 12 right now. Okay, so I've cleaned that for 30 seconds and I've allowed it to dry and I've injected the 12 units of hair in here because the doctor wants 12 units. I'm just going to be opening this and dropping it, and then I'm going to inject 12 units of air into the valve, and then I'm going to turn it over. I'm going to be getting the 12 units that I need. I'm just going to take my pen, and then I'm going to get out the bubbles. I'm just going to be getting out all the bubbles. Okay, so I'm just going to draw out more. Okay, I'm going to bring this out, and then I'm going to be covering it back through the scoop method. So I'm dropping this on the table. I'm going to covering it back through the scoop method. Okay, so I'm putting it here. So now I'm just going to drag down to take out all the bubbles. I'm just checking for bubbles. So I have some metal on my hand. I'm going to be doing hand hygiene. So I have some metal on my hand. I'm going to be doing hand hygiene. So I'm doing hand hygiene. And this is 12 units. Yeah, so I have 12 units here. I'm just gonna be stirring. So to registered nurse have confirmed this measurement, so I can go ahead to give it, and I'm going to be labeling immediately. So I'm just going to put this down and then do my labeling. So this is nursing Jake. NJ is the same thing as nursing Jake. The drug name is Emmeline and MPH. The volume I'm giving is 12 units. I'm giving it through the subcutaneous route. The concentration is U100. I'm just gonna clean this. Okay, so I'm giving U100 per ml, and then the date is February 7, 2021. The time is currently 7:41. My signature is TB UMSN2. So now I'm just going to be sticking this right in where it's not going to affect me, and I'm going to be doing my second check immediately. So nursing Jake, Emmeline N, insulin, Emmeline N, insulin MPH, Emmeline N, insulin MPH, Emmeline N, insulin MPH, and this is Emmeline N, insulin MPH. The doctor wants 12 units. It comes in U100 per ml. This is U100 per ml. The syringe is calibrated into U100. So I'm supposed to have 12 units here, and I have 12 units. Yes, I have 12 units. I'm just going to be showing that to the camera that I have 12 units. Okay. It's through the subcutaneous route, and here it also says for subcutaneous use only. In AM is due for 8 o'clock. My scenario time says 7:45 a.m. and I've confirmed one has given it today, so I'm going to be giving it. I'm going to put this back in the cart. I'm going to take my gloves. I'm going to take my alcohol swab. I'm taking my gloves, my alcohol swab, my cotton bud, my med card, my medication, my pen, and then my mask sheet. I'm taking all these to the patient room. So I'm carrying all these to the patient room. So right now I'm at the patient room. I'm doing my hand hygiene. Hi, my name is Taiwo Busari. I'm a nursing student at the University of Manitoba. I'm going to be a student today. I'm doing my safety check. I'm doing my hand hygiene. I'm doing my safety check. The patient is at lowest position. The core bell is at reach. There is no distress. The patient is comfortable. The patient is at lowest position. Core bell at reach. There is no tripping outside on the floor. The core bell is at reach. The patient is okay. I'm just going to confirm I'm in the right patient room. So nursing Jake, the phone number is 312-654-987. Okay, please can you tell me your name, please? Nursing Jake. Okay, thank you very much. Can you tell me your date of birth, please? January 1996. Okay, thank you very much. Do you have any allergy? No, you don't have any allergy. Okay, according to the mark sheet, you don't have any allergy, so I'm just going to be doing my third check before giving you the medication. So now I'm just going to do the third check. Nursing Jake, inulin and insulin, MPH, inulin and insulin, MPH. The doctor wants 12 units. It comes in U100 per ml. This is calibrated in U100 per ml, so I'm supposed to have 12 units. And I have 12 units here. Yeah, so I'm just going to be showing that to the camera that I have 12 units. It says to the subcutaneous route. I'm going to be giving to the subcutaneous route. In AM is due for 8 o'clock. My scenario time says it is 7:45, so I can go ahead to give it. So registered nurse have confirmed the measurement of the medication, so I can go ahead to give the medication. So first of all, I'm just going to put the patient on my waist level. Like I said earlier on, my name is Taiwo Busari. I'm a nursing student, second semester. I'm here to give you insulin. The insulin I'm giving you today is the intermediate insulin. I am giving you the insulin to control the hyperglycemia. Currently, your blood glucose is 10.8, which is high. So the action of insulin is to lower your blood glucose. The onset of the medication is 1 to 2 hours. The peak is 4 to 12 hours, and the duration is 18 to 24 hours. Due to the duration and the peak, I'm going to be assessing you throughout the whole day for hypoglycemia, which the symptoms includes anxiety, confusion, and drowsiness. And I'm also going to be assessing you throughout the whole day if the medication was therapeutic. The contraindication of this medication is hypoglycemia, which includes anxiety, confusion, and drowsiness. I am assessing you, and I cannot say no the contraindication, so I can go ahead to give it. Another contraindication is allergy. According to the mark sheet, you don't have any allergy, and I also actually you told me you don't have any allergy, so I can go ahead to give you. The adverse effect of this medication is also hypoglycemia, which includes the symptom of hypoglycemia is anxiety, confusion, and drowsiness. Hypoglycemia means like your blood glucose is very, very low. So I'm going to be assessing you throughout the whole day for symptoms of hypoglycemia. If you feel any of these side effects, which includes anxiety, confusion, or drowsiness, please let me know. Just make use of your call bell. The patient education is that please do not rub the site when I give you the medication, and also avoid to use alcohol. Avoid to take alcohol when I give you this medication. So I'm just going to put you through the med. So can I go ahead to give? So your blood glucose is 10.8, and we're trying to decrease the blood glucose to 5 within 5 to 7. That's what the insulin is going to do. And please do not rub when I give you, and also avoid with the use of alcohol. And signs and symptoms of hypoglycemia includes anxiety, confusion, and drowsiness. Please, if you feel any of this, please let me know. Can I go ahead to give you the medication? Yes. Okay, so I have pulled you to my waist level, and you told me I can go ahead to give you the medication. I'm also going to be doing my hand hygiene and wearing my gloves. I'm just going to pull you through. So the medication insulin, I'm going to be giving you through the subcutaneous route. I'm going to be giving you a fatty tissue. I'm going to bunch 2 inches. I'm going to be giving you 90 degrees. I'm going to bunch 2 inches. I'm going to give you 90 degrees. I'm going to be giving you at the right upper quadrant of the abdomen, 5 centimeters away from the umbilical cord, and I'm going to be preventing. I'm not going to give you anywhere that has redness or swelling, and I'm going to be exposing just the abdominal part. I'm going to be cleaning with alcohol swab for 30 seconds in a circular motion. So I'm giving you 90 degrees. I'm giving you 90 degrees. I'm bunching 2 inches. I'm giving you at the right upper quadrant. I'm giving you 5 centimeters away from the umbilical cord. I'm preventing anywhere that has redness or swelling. You're going to feel a sharp pain. I'm giving you this subcutaneous route. You're going to feel a sharp pain, but it's going to go in no time. So I've cleaned the alcohol swab. I'm bunching 2 inches. I'm giving you 90 degrees. You're going to feel a sharp pain, but it's going to go in no time. I'm going to give you in 3, 2, 1. And then I'm going to stabilize with my 2 fingers. I'm going to give you slowly. I'm going to activate my vanish point. I'm going to put this in the sharp containers. I'm going to use the cotton bud. I'm going to press it down for a few seconds. And then I'm going to cover you back. I'm just removing this. I'm putting this in the garbage. I'm removing my gloves. I'm doing my hand hygiene. And now I'm just going to be documenting. I gave you 12 units of MPH, insulin, through the subcut. The time is 7:45 a.m. My signature is TBUMSN2. I gave the patient before meal at the right upper quadrant of the abdomen. So right now I'm just going to be putting you back at the lowest position. So thank you very much. Like I said earlier on, I'm going to be assessing you throughout the whole day because it's an intermediate medication. I'm going to be assessing you throughout the whole day for hypoglycemia, which includes anxiety, drowsiness, and confusion. I'm also going to be assessing you throughout the whole day if the medication, I'm going to be assessing your blood glucose throughout the whole day if the medication was therapeutic. So if you feel any of the side effects I told you, which is anxiety, confusion, drowsiness, please let me know. So I'm putting you back at the lowest position. So just for the sake of I'm putting you back at the lowest position. The patient is not at distress. The patient is comfortable. The core bell is at reach. There's not any tripping outside on the floor. So now I'm just leaving the patient room. I've done my exit safety check. Patient is bed is at lowest position. Core bell at reach. The bed is at lowest position. Core bell at reach. There's no any tripping outside on the floor. And core bell are reach. There's no tripping out on the floor. So now I'm just going to leave the patient room. So throughout the day, because it's an intermediate medication, I'm going to be assessing throughout the day if the medication was therapeutic, if it actually decreased the blood glucose. I'm also going to assess throughout the whole day for hypoglycemia effects, which includes anxiety, confusion, and drowsiness. The patient tolerated the pain well, and I'm using a pencil, but in a real life scenario, I'm going to use a pen. So I'm done with my demo. Thank you.